Okay, this video is going to be for informational purposes only. I literally am like a couple of hours post surgical procedure. I just had these bitches removed from my body. So I had a explant under local anesthesia, which if you're not familiar with plastic surgery, I didn't even know this was a thing. Okay, I am an NP, but I'm a hospitalist, so I work in the hospital. I rarely deal with plastic surgery things. So I really appreciated my surgeon and all the education and everything. Everything was just an amazing experience. Getting them in, I had no problems. Like recovery was okay. The reason I wanted them out, I can do a whole video on that. But it was a combination of aesthetics, aging, thinking I want kids type of thing. Not that implants under the muscle would affect breastfeeding or anything like that. Um, but also just like my mentality and my outlook on life. I missed the way God made me. If I could go back in time, I would have never had these. I got these when I was very young, and nonetheless, now they're here. So, local anesthesia. So, essentially, my experience was I went into the office. He kind of looked at everything. He asked me if I wanted a lift, and I did not get a lift. I asked, if I could just give myself some time because I'm still young. I'm very active. I have very elastic skin still, and my implants were quite big, but at the same time, like they were under the muscle, and I think they'll bounce back just fine without a lift. So I did not for a lift, and because of a lot of things, me not wanting to take a lot of time off of work, me like wanting to just have a quick procedure to remove them. I read lots of science on capsulectomy versus non-capsulectomy, and my capsules were still really soft. And having a capsulectomy would be a much longer, more painful recovery. So I opted to just have them removed under local anesthesia. Please do not give me all your comments in the comments if you are like dead set on capsulectomies versus not. I opted to not. I opted just to remove them. So it took about an hour and a half. It was amazing. Um, they give you some, or I was given like oral anti-anxiety medication and oral like pain medication to take before the procedure. I was so relaxed, and I did not feel anything. If you ever had dental work done, it was less painful than that for me. Like it's no pain. Um, they numb the area where they're going to make the incision, and then they take time to numb even further. And within, I want to say 2 minutes, they were both out, and I didn't feel anything. Like I've seen different YouTubers and TikTokers talk about having them removed under general anesthesia, and they talk about how they felt tugging or like pulling. I didn't feel anything. My surgeon was very gentle, and I feel like they just kind of slid out very easily. He said there was nothing worrisome on the inside, no like masses, tumors, things like that, no like fluid around the implants, nothing concerning. And so yeah, they're completely intact, and here they are. Now looking at them, these things are fucking ginormous. I don't know how these were inside of me, but that was my experience with removing my implants under local anesthesia. I think that if you are not 100% certain that you're having like breast implant illness, if your capsules aren't like super hard and like stuck and things like that, it's a great option. I had a very good experience. I can't complain. I just wanted to hop on here straight out of the procedure and say I'm okay. I have no pain right now, nothing. And I didn't get any IV pain medication, no sedation, no like nothing. Feel great. And I'm going back to work in a couple of days, which is so nice. I didn't have to take time off work. So yeah, they're out. And I don't know. I asked to keep them. I don't know what I'm gonna do with them. Kind of weird to have these things that were in my body and my hand. As far as how things look, I got a quick look at what they look like. Kind of looks like they did before I had these put in. Um, there is some like, I don't want to say loose skin, but they look a little different. But I mean, I was told after 6 months just to reevaluate because your skin kind of like goes back to the way it was, but it looks the same to me like treatment, so it's not much different, which is kind of good. So yeah, that is it. And if you are thinking about getting these, I would definitely say recommend you waiting to at least be around late 20s, maybe even 30s in your life. Wait till you have kids. Think about it. If you have any sort of autoimmune disease in your family or anything like that, I would just not get them. Obviously, if you have some sort of cancer, breast cancer, and you're doing reconstructive surgery, they're great. They're a great option, but they do have, risks, and weigh your risk versus benefit. I can do a whole video about why I got them out in depth, but yeah, good experience. Local anesthesia, thumbs up. Oh, and by the way, I went with El Paso Cosmetic Surgery in El Paso, Texas. Dr. Jaber did my breast implants, and then he removed them afterward. And can't say enough good things about their staff. They're all super, super sweet. Like, text me, check up on me, like, how you doing? Like, remind me of my appointments. Like just amazing, amazing people, amazing nurses, amazing physicians. Like, I couldn't ask for more. I think they were awesome. So yeah, that's it.